I am Halton, and this is my mental health presentation.
About 1 in 5 Canadians experience a mental health problem in a year, and roughly 7.5 million Canadians are living with a mental health problem or illness. With the amount of people in need, wait times to see a mental health professional through the public sector are becoming a problem. So, how is Canada responding?
But overall, wait times are way too long. It is not uncommon for somebody, and even a youth, who shows up who wants to get help, being told they have to wait 12 to 18 months. That simply isn't acceptable, and leads us to have our mental health system very, very fragmented, and a huge gap between the delivery of mental health services and physical health.
In Ontario, wait times for publicly funded counselling and treatment for seriously mentally ill service recipients has increased to a 56-day wait and an additional 16-day wait to be eligible for the services. In British Columbia, the rate of depression among youth in BC has increased by 50% from 2013 to 2015. And anxiety has increased by 135%, but the ministry doesn't report on wait times for these services because they say there's no standardized definition or process for collecting this data across jurisdictions. Yet, the province currently spends $2.5 billion every year on mental health and substance use services, most of which goes to hospitals. In Alberta, wait times over the last 5 years for youth addiction residential services has gone from 24 days to 47 days. The province has very limited data on wait times. Manitoba was also not able to provide data on wait times as it is not tracked by the provincial government. So how can this gap across Canada be filled?
The real gap is funding, and funding in the right places.
A point that many advocates of mental health are trying to make to the government, especially with the federal election coming up.
How are we measuring that money? How are we ensuring it's getting to the right places? What kind of indicators are we leveraging?
It has to be coupled with innovation. If we're going to invest in doing more of the way we have always done things, then we're going to continue to do more ways of doing it wrong.
Hosseini says that allocating funding towards community mental health services can be Canada's biggest tool in solving this issue.
Ensure that community mental health supports are getting that investment, because that's where you're going to get the biggest bang for your buck. That's where you're going to get the help to the majority of the people in Canada, and that's the area that's been chronically underfunded.
Mental health advocates are keeping a close eye on this election to see what solutions might be put forward.
Some causes of mental illness is social isolation, loneliness, bullying, bereavement, drug and alcohol misuse, and homelessness. The social issue and its importance. Mental health is a social issue because it affects individuals and their interactions within the community. It can lead to various challenges such as stigmatism, discrimination, lack of access to mental health services, and limited social support. The impact of mental health issues extends beyond the affected individuals, affecting their families, friends, colleagues, and broader society. How many people are affected by mental health? There are over 970 million people around the world that are living with a mental disorder. Every 1 in 8 people have a mental disorder. In 2022, there was over 5 million Canadians that had a mental disorder. About the charity and its history. The CMHA focuses on promoting positive mental health and well-being through various initiatives, such as public awareness campaigns, education programs, and community events. They work to reduce the stigma surrounding mental illness and encourage mental health literacy. In the 1930s, the organization established multiple provincial divisions in Canada. Each division aimed to address specific mental needs at a local level. My charities team. Some of my charity services are telemedicine/virtual care, family mental health initiative, crisis services, youth addiction counseling, and case management. My charity's mission and vision. The mission of the Canadian Mental Health Association is to promote the mental health of all people and to support resilience and recover from mental illnesses. The vision of the Canadian Mental Health Association is to support people living with mental health issues, to achieve resilience, recovery, and well-being, and to improve public awareness about the importance of mental health. They aim to help build inclusive communities where people with mental health challenges have access to information, support, and treatment they would need to thrive. Effects on the community. Mental health problems can affect concentration, motivation, and overall academic performance. This can lead to lower educational attainment rates and subsequent impacts on workforce skills and opportunities within the community. It can also affect the connectedness of the community, as well as drop the productivity rate of the community. It can also have long-term effects on people that can last for years. How you can get help? You could start by reaching out to your primary care doctor, who can refer you to a mental health professional or a specialized mental health clinic. You can also contact helplines such as crisis hotlines or local mental health organizations for immediate assistance. Additionally, online support groups and resources are available to provide guidance and connect individuals with relevant support services. How people can change their attitudes to help address the social issue. Learn about mental health conditions, their causes, symptoms, and available treatments. Understanding the subject better enables you to provide support and reduce stigma. Use your voice to promote mental health awareness and fight against misconceptions. Share accurate information through social media, blogs, or community events to help reduce the stigma surrounding mental health. Some of my values are honor, risk, and truth. Why I think my charity deserves this grant. I think my charity deserves the grant because they are doing a great job and trying to solve a major problem in our society. My charity is well organized and well managed, so I believe they could use the $5,000 very wisely, and that it could make a real difference. What $5,000 would do for my charity? $5,000 would help my charity so much. They could use it to boost research on mental health or to help people get help for their problems. They could use it to renovate their buildings or provide more services to the community. It would help so many new people that need help find the help they want. My charity's info and location. My bibliography. And a thank you note. The end.